subsequently dropped out of high school. All of her kids at the time were less than 8 years old, and 2 of them were premature. She lost one in a late miscarriage, the 5th pregnancy, and so she was here now with another one, had been in a very vicious cycle of domestic violence, periods of homelessness, suffering from depression, anxiety, smoking, had very poor mothering skills and coping skills. And I'll just tell you that when I saw her, she had no laptop, she had no desktop, but she had a prepaid cell phone, and that becomes important later. And then my favorite patient in the world is this one, and this is me. So this is my story, and I'll tell you a little bit about how I ended up here and how I ended up connected to Text for Babies. So in the year of 2009, going to 2010, I had a pregnancy. It was my 2nd pregnancy. And I had every reason to have a good pregnancy, but during the course of that period, I had 10 hospitalizations and multiple other encounters with the healthcare system that was just extremely frustrating. So a lot of times when I would go to the hospital or to the doctor's office, I would not tell people that I was a doctor because I didn't want, partial treatment or anything. And so I would find it very difficult to get information. So nobody would tell me what this meant, what this diagnosis meant, what you need to do when you leave. They would just say, this is this black lady here, and just, you'll be fine, and go see your doctor when you're done. And I would just struggle with the fact that I wouldn't get information. And then I would sometimes have to pull my doctor card, which I don't like to do, but I did. I would say, I'm a doctor, talk to me like a doctor, and speak to me as if I know something. And what would happen in those situations that they still wouldn't tell me anything because they would say, oh, she's a doctor, so she knows. So you know what, you're fine, just, you know what to do. This is basically blank, this problem, so you can go and take care of that on your own. So in both settings, I was not really able to get adequate, timely health information. And I had every reason to have a good pregnancy, as I said before. I was very well educated. I went to Ohio State University, as I mentioned earlier. I went to Columbia to do my residency in family medicine, then went to Harvard to do a fellowship in minority health policy. I was in my mid-30s, married, non-smoker, healthy lifestyle, had all these different positives that should have meant she would have a good pregnancy with a very good outcome. But I had one strike against me, and that strike was that I was a black woman. And because of that, the scale was tipped very much against me. So in that period, I was working at Community Health Center, Inc., where I am now the Chief Medical Officer. It is Connecticut's largest federally qualified health center, and I really appreciate the Lieutenant Governor's comments on the role of health centers in reducing disparities. We are a patient-centered medical home, as Ms. Braintrust talked about, and we serve patients in many, many communities throughout the state of Connecticut. We have about over 130,000 patients that do about 400,000 visits a year. Most of our patients, 90%, are at or below 200% of the federal poverty level. About 65% of them are racial and ethnic minorities, and about 65% are women. We deliver about 700 babies a year in that setting, and most of our patients, nearly half of our patients, about 42%, are under the age of 19. So these women that I take care of in my practice as a family physician and in our organization, and very similar to the communities that many of you come from, are in that low-income group, less than 200% of the federal poverty level. This is from a Kaiser Women's Health survey that was done a few years ago, and they were looking at women who needed medical care, but they delayed or forewent the medical care entirely for reasons. They looked at what those reasons were. And if you were in the low-income group, less than 200% federal poverty level, you were more likely to delay care because you didn't have insurance, you couldn't take time off of work, you had child care problems, or you had transportation problems. But we've long felt in healthcare that if we build these big, beautiful buildings, these great places, these illustrious and elaborate designs, that people will come and see us. But we've been finding more and more in our population there in Connecticut, and probably in many of your communities, that people are really looking for ways to connect without being in your office and listening to you, and just hearing about how much we use radio. There's so many other ways that people are getting information. We've also long felt, as physicians and as the healthcare community, that we are the most important and critical source of health information. That's where people access their healthcare information. But we found over time that we really are not, and that many people are looking at how do I get information without having to go into that office, and how can I connect without really being in person. But regardless of that, we still need to reach these women, and as I said, so even if they're going to forego their care because they cannot get access, they can't take time off of work, we have to be able to reach these women so that we can reduce these disparities in infant mortality and preterm birth that we talked about. So there have been a number of things that have been proposed as strategies to do this, and I'm not going to go into details about all of those in the interest of time, but I want to talk about one that has been especially compelling, which is Text for Baby. Text for Baby is a free texting service that provides pregnant women and new mothers up to the first year of the infant's life with free timed health information that really enables them to give their babies the best start in life. It's an educational program of the National Healthy Mothers, Healthy Baby Coalition. The founding sponsor has been Johnson & Johnson. And the text messages go to over 400,000 moms in English and Spanish, so it's the largest mobile health initiative to date. I signed up for Text for Baby during that pregnancy that I told you about when they first launched. I actually heard about it because they were asking our organization to be a referral site for women who were pregnant in the central part of Connecticut. So I decided to sign up as a user and was absolutely amazed. You know, I would get, you know, by just texting my date of birth and my zip code, I got free tips 3 times a week all throughout the course of the pregnancy. There was information on how to enroll in Medicaid and CHIP, how to find a healthcare provider, what are urgent alerts you should be aware of, how to be aware of your appointments, and feedback on a number of different things. So it really became the most critical engine of health information that I could get during that pregnancy when nobody would tell me anything. And just so you're aware, you know, the content development process is highly elaborate, highly rigorous. There's a very detailed literature review, a lot of content review, expert review. It's tested, it's revised, and numerous healthcare bodies and institutions provide that input and that guidance during the process. So it's highly sound, and for those of you who are in the medical community, you will feel very confident in the messages. And it addresses all those major domains of solutions to the infant mortality and preterm birth disparities that we've seen in the African American population, because it covers the different topics that I didn't go into detail in. Text for Baby has more than 820 outreach partners, including health plans, state and local Medicaid agencies, health organizations, hospital networks, media, federal agencies. And they've really done an excellent job of making sure that this is everybody's business. And it's been a very exciting example of a public-private partnership through numerous organizations, including CTIA, FOXIVA, the Department of Health and Human Services, and many others. So I guess you're wondering, does it work, and does it matter, and has there been any impact from this program? And the University of California at San Diego and the National Latino Research Center has shown that women are finding that it helps them remember their appointments. It gives them warning signs that they don't know of. It helps them talk to their doctor about things that they've read on Text for Baby. So really, it is facilitating interaction and increasing the patient empowerment. My patient that I talked about earlier used Text for Baby and went on to have a successful pregnancy, did not deliver a premature child, and got a lot of messages that were relevant to